Now I introduce you to Michael Bertrand, the President and CEO of Lutheran Child and Family Services. He joined LCFS in 2005 and has served as LCFS's Northern Illinois Director of Children's Services, Chief of Children's Services, Chief Program Officer, and Vice President and Chief Operating Officer, with more than 30 years of social services experience. Mike has worked for the Department of Child and Family Services, Lutheran Social Services of Illinois, Hull House Association, and United Healthcare Corporation. Mike has a bachelor's degree in psychology from the University of Illinois at Champaign-Urbana, a master's degree in social work for the University of Illinois at Chicago, and is a licensed clinical social worker. He is passionate about ensuring that we never give up on a child and was a co-creator of the award-winning Regenerations Programs 2006 for dually involved youth, which has produced successful and promising outcomes for children in the juvenile justice and child welfare system. Currently, Mike is a board member of the Illinois Collaboration on Youth and serves on the Executive Services Corps, SESC, Nonprofit Advisory Council. Mike is nationally active in both the Alliance for Strong Families and Communities and Lutheran Services in America. Welcome, Mike.
Good morning, everybody. It's good to be back together. I didn't thank you for that wonderful introduction. As you can tell, I had trouble keeping a job, but have proudly actually on Monday celebrated my 17th anniversary at LCFS, and have been blessed to lead this wonderful organization for the past few years, as well as directly before coming, I worked at Lutheran Social Services. So it's great to see so many faces. I'm praying we're all together again in Springfield next year, and that the pandemic is behind us. As Pastor Clark relayed, Lutheran Child and Family Services of Illinois has been partnering with LSSI since the inception of Lutheran Day, and we wanted to highlight as part of this presentation something that happened in this last session, which was the passage of the Bias-Free Child Removal Pilot Act. Really quickly, our mission is to nurture and strengthen children and families in need. That's what we do day in and day out to the families that come to us. We're largely about 90% of our services are in partnership with the Department of Children and Family Services, and we serve about 2,000 children in foster care at any moment. Between Lutheran Social Services, who is the largest private provider of foster care services in Illinois, and us, we are the second largest. We are clearly, the Lutheran world has a significant presence in that. But we also have a vision in addition to our mission. And our vision is a world where all of God's children have the opportunity for safe, healthy, and meaningful lives. And this is really a big part of what powers our advocacy work and powers our focus on advocacy is to say we don't want to do high quality service, not just for the families that come to us. That's at the core of who we are, but we also want to see a world again where all of God's children, not just the ones that come through our doors, have the opportunity for safe, healthy, and meaningful lives. So that's really a lot of what powers our advocacy work, and led us to look at the child welfare system that we're such a large part of, which has historically, for quite some time, been significantly, children of color have been significantly overrepresented within our systems. And that's something that the child welfare community has struggled with for quite some time. And we've always had this history of kind of saying, let's scratch our head, let's do something, but it's a larger issue within the larger society. And the dialogue wasn't moving much beyond that. So we decided that we were going to start to move that dialogue. And as I stated, children of color, they stay in foster care longer and achieve permanency at lower rates than Caucasian children in foster care. So we decided of our 2,000 children at any moment that we can't go challenging our colleagues around the state and around the country to do different until we challenge ourselves first. So we've done a lot of work in this area, and this is not what we're here to talk about, but we kind of started a significant push in 2019 and started using data to really look at our system and look at our youth and the experience that we were having. So as you can see on the kind of first bullet point there, from June 19th to June of 2021, we increased the permanency rate from 10% to 26% for youth of color. Actually, we increased it from 24% for 30% for Caucasian youth. So all boats were raised. But as you can see, the disparity where within our own system, the disparity for achieving permanency was decreased by from 14% between what were happening for youth of color to 4% currently, or as of the data from the close of fiscal year 21. So we've been able to eliminate that disparity while at the same time increasing permanency for all youth. And at the same time, Caucasian youth in 2019 spent an average of 537 days in care versus 674 days for youth of color, an 82% disparity. But we were able to move that to 432 days in care versus 591. So still the disparity, 73%, brought it down by 9%. So that's kind of sort of the background on as some of our efforts to say, we want all children to have a similar experience. We don't want race to come into play as to what the families achieve, both from LCFS, and as you can see, we still have some work to do, but larger within our child welfare system, which led to what we're going to be talking about and what one of our colleagues who sponsored the bill or brought the bill to the General Assembly at ICOI is going to be talking about. But controlling the front end, controlling looking at is there any type of bias in the decisions of whether or not a child should be taken into care and taken into foster care. And in Pastor Clark's introduction of me, he relayed that I worked for the Department of Children and Family Services. My first 7 years of my professional life, I was a child abuse and neglect investigator for DCFS. So I have a very intimate knowledge of that part of our system and the families that are out there struggling, and that's what guides me day in and day out. But as you can see by this very simple graphic, and I had to pull what data was available. So in 2020, in the state of Illinois, children 19 and under, about little over 15% are, and I just chose to focus on African American children. We're roughly 15.2% of our population. But as of May of 22, as you can see, 44% of the children in DCFS care were our Black children. So you can see there's a significant overrepresentation of children of color within our system. We, again, in my very lengthy introduction, we are very active in the Illinois Collaboration on Youth. As shared, I've been blessed to be on the board. And every year, ICOI has a policy group with staff as well as members, and LSSI is also very active in ICOI and sits on that group. Looks at what coming into the legislative session, what are going to be our priorities and what are going to be bills and what are going to be advocacy positions that we are going to take. And one of those was to push a bias-free child removal bill to have that piloted in Illinois. And Ashley, our ICOI representative, is going to talk about that again. As I said, this was their bill, but it was founded upon the belief that around the country and other areas, some folks have started to take a look at this, and most known is in Nassau County, New York, where they instituted a blind removal process, removing all identifying any information that might identify race, income, that sort of thing. We're able to decrease the percentage of Black youth coming into foster care by 60%. And interestingly enough, all youth coming into care by this kind of a closer review process they were able to decrease the amount of youth coming into care overall. And then there's some additional pilots going on in Michigan and Los Angeles, and Ashley may know from there also. Don't think so. So now I'm going to introduce Ashley Deckert. She is the Director of Public Policy and Government Affairs for the Illinois Collaboration on Youth. Prior to joining ICOI, Ashley was the Deputy Director of Child Services at the Illinois Department of Children and Family Services. As Deputy Director, she had the oversight and responsibility for 4 statewide divisions: residential monitoring, residential recruitment, foster parent recruitment, and juvenile delinquency and restorative justice. A lot of cross between youth and child welfare and youth that end up involved in the juvenile justice system and the adult criminal justice system. She was with the department for 13 years, having served in various roles, from direct service in the Intact Family Service Division, supervisor in the Division of Child Protection, and various leadership roles within the Division of Licensing. At ICOI, Ashley represents members in the development of state policies and practices to improve child and family well-being. Thank you so much, Ashley, for joining us today and your willingness to share more about the bias-free child removal legislation. And thank you for all your work on that bill that has resulted in it passing and being signed by Governor Pritzker. So I'm going to turn it over to Ashley to go a little bit more into detail about that bill and what that's going to mean for children in Illinois.
All right. Thank you so much, Mike. And I appreciate having the opportunity to talk to you all about the bias-free child removal pilot program that was just signed into law as of June 10th. So, okay. I'm going to just kind of really expound upon what Mike started to discuss around the overrepresentation of Black children in care. As he spoke to that, we decided to partner with Representative Carol Ammons and Senator Karina Villa to develop the bias-free child removal pilot program, which again was signed into law on June 10th. The concept was modeled after a pilot program that was successfully initiated in Nassau County in New York. And they saw the reduction go from about 60% to 29%, which actually led to New York implementing it as an actual practice in the state of New York across the entire state, which is encouraging because it really meant that they saw that this type of approach and practice had so much of an impact that they wanted just embed it within their practice overall. And so our strategy is similar. And I'll go into a little bit of our strategy. When we developed this legislation and wrote it out, we wanted to make sure to really make sure that we wrote it in a way that was specific to Illinois, because Illinois is a different state. Many of the other states, they are county-based in the way that they manage their child welfare system. Obviously, Illinois is statewide. So we wanted to make sure that we wrote it in a way that was really representative of our state in particular. Just to go into the basic details of the law, DCFS will have until January 1st of 2024 to implement a 3-year bias-free child removal pilot program in DCFS field offices located in DuPage County, Champaign County, and Williamson County. The reason these counties, 2 of the counties in particular were chosen was based on the data which suggests that specifically in DuPage County and in Williamson County, they have the highest number of disproportionate amount of African-American children in care, or Black children in care. And again, I want to stress that we're focusing primarily on Black children because there's a phenomenon in Illinois where there's actually an underrepresentation of Latino children in foster care, and the numbers for white children are proportionate to their population in the state. It doesn't mean that we don't believe that this pilot program can potentially impact the outcomes for them as well, but obviously the focus is especially on Black children who are clearly overrepresented. And so Champaign County was the county that was chosen because one of our representatives who carried the bill is out of Champaign County, and she really wanted to have an impact on her county as well. So we're hopeful that throughout the process, we'll be able to see the outcomes improve for children in Champaign County as well. So prior to the implementation, by January 1st of 2023, DCFS will be expected to establish a steering committee consisting of an interdisciplinary, diverse group of child welfare professionals and advocates who will be responsible for the development and implementation of the pilot program. So we wanted to make sure that this bill was written in a way that still allowed for the people who are experts in this area, the people who are on the ground and working with families and children, the people who are strong and fierce advocates for families can be at the table and can develop something that actually works for Illinois. So we didn't want to be too prescriptive in the legislation, but just prescriptive enough. So the steering committee will establish 3 bias-free case review team members for each county with the pilot program. The review team will be diverse in regard to members' geographic location, their race, their ethnicity, and gender. The review team will be made up of 1 child protection supervisor, 1 area administrator, and 1 regional administrator. To be clear, those will be staff of the Department of Children and Family Services. So that steering committee would be made up of those DCFS staff. The redacted information consists of a family's name, their race, their socioeconomic status, education level of the parents, their address, and in certain cases, religion, ethnic, and sexual orientation, with a focus on evidence, safety factors, risk elements, and family strengths. The reason we say in certain cases is because sometimes there are investigations and situations that would require knowledge of those things, because that might be the reason why the investigation came into the department's purview. So for instance, if a child's sexual orientation led to their abuse, that would be something that would be important to know. The steering committee will have the responsibility of determining how quickly the review team meets, how quickly a decision has to be rendered, et cetera. There are actually lots of things that are prescribed within the legislation or the law now that the steering committee would have to develop, but I wanted to primarily focus on how quickly they have the information be provided to them, and how quickly they make the decision will be determined by that steering committee. There are cases that will not be included in the pilot program, and those are when PC has been taken or protective custody has been taken by law enforcement or medical professionals. So they have the delegated authority to remove custody from a parent. And in those instances, we're going to have that be excluded from the pilot program. Cases that involve forensic interviews by a child protection investigator or law enforcement. Usually when a forensic interview has to take place, it is around child sexual abuse or severe physical abuse. And in those cases, we're gonna have that be removed from the pilot program. Cases that include photographs of injuries, because clearly if it includes photographs of injuries, you'll be able to identify the race of the child in most instances. And so in that case, it'll be removed from the pilot program. And finally, any case where the child welfare court has made a determination on the issue of custody. There will also be an advisory board that's established for the purposes of this pilot program. We thought that that would be important because we want to make sure that there's fidelity to this process. They're expected to be present for all case reviews for the purposes of ensuring that the review team executes the bias-free removals in accordance to the act. The expectation is that the pilot program be expanded statewide if the evaluation of the pilot program reveals that disproportionality of BIPOC children is reduced by the end of the pilot program. And if you're not familiar with the term BIPOC, that's Black, Indigenous, People of Color. So every year following the first year of implementation of the program, part of the law states that the department would have to contract out with an evaluator who would do an evaluation of the process so that we're tracking it over several years. So I want to note a few things in general. This this pilot program is not intended to be the fix for racial disproportionality for the child welfare system in Illinois. But we do believe that this is one of many things that can be implemented that would lead to overall better outcomes for children of color in foster care. So our hope is that this, in addition to for example, a bill that was recently passed by ICOI last year that requires mandated reporters to take implicit bias training, coupled with that and other thoughts and ideas that we might have at addressing this issue would actually eventually lead to the reduction of children in foster care. As Mike mentioned, I've been working for the department for 13 years. I've been in social work for 15, and I believe that this is this is the first attempt that we've really outwardly made to try to address it. We've always talked about it. We've always known that this is an issue, but it's one thing to talk about it, and it's another to put things into action, to actually see how we can improve outcomes. So I'm really excited about this, and I'm open to any and all questions you all might have. Thank you.
Thank you, Ashley. Appreciate it. And as Ashley said, and I know as Lutherans, as Christians, as people of faith, we want a world where all God's children are given the respect and the dignity that they are due as children of God. And this we feel this is one, as Ashley said, one of many steps to say how are we ensuring in our state that is lived out. So. I know we have time for questions at the end. Do we want to do a question now? I know we're a little bit behind schedule, or we're right on schedule.
You've got time for a couple questions, Mike. Go ahead.
Great. Does anybody have any? Or I know one would be, so Ashley, do you have any thoughts and insights as to how, because obviously when a report is made to the child welfare system, it usually comes externally, and you reference the training for mandated reporters. But what else can we do to influence the police departments, the school systems, the other folks that may unawarely saying, well, am I reacting in a way based on societal bias differently towards an African American family, and maybe calling the hotline when I might not on a Caucasian family? Any thoughts on how we impact the judges, the courts, the other systems that our system is so tied to and important?
Thank you for that question. One thought is that we could possibly and potentially see those people represented on this steering committee, right? If they're a part of if we're engaging them on those issues, and they're a part of, for instance, this steering committee for the bias-free pilot removal, that's a step, right? But also forming partnerships across the state. Not only would that necessarily be the responsibility of DCFS, probably led by DCFS, but encouraged by different child welfare organizations where, we're consistently engaging with and having conversations with judges, roundtables, things that might actually shift the cultural view and thought of how children become involved in the child welfare system. Because I think it's important to try to really impress upon those systems that we have to be, there's a place for mandated reporting, but there's also a place for being a mandated helper or supporter, right? And so what are some things that we can do beforehand to try to help families before we do what's equivalent to calling the police on a family? Because it's quite a scary thing to have a hotline called on you, right? It feels, that this person that knocks on your door has the delegated authority to remove your child. And so before we get to that point, are there other things that we might be able to do to help and support families? And I think part of that is just, from my perspective, initiating the conversation, bringing people to the table, talking about what else exists outside of the DCFS child welfare system that might be of support for families prior to them even being involved with the department.
Ashley, I just have one question that kind of harkens back to what Representative Harris was saying, and that was kind of involvement. And I know that, LCFS, LSSI, through all the partnerships that ICOI has with providers, would you say that this legislation is kind of an example of how these organizations can, how we are helping to influence positive change within the department? Would you say that this is kind of part of the process and representative of how ICOI's work and our organization's work help, push these things forward?
Yeah, absolutely. You know, the fact that in developing the legislation, we had so many people take part in reviewing and providing feedback, including DCFS, it was significant. You know, so the partnership around wanting to make sure that this was represented the best way as, we could possibly present it is phenomenal to me. We had, DCFS at the table. We had the Office of the Public Guardian, the ACLU, NSAW, so many people, other advocacy groups, Ascend, which is a domestic violence advocacy group, was able to provide some feedback. So when you get all of those people at the table, those are just to name a few, it's plenty more. But when you get all those people at the table, one, their voices are being heard in the process, but also there's buy-in when you can really, really show the intent and hope for something like this, and how the intent is to improve outcomes. I think people can rally around that. And I think that's the reason why it ended up passing unanimously in both the House and the Senate, because we were able to get everybody to the table and have them understand the true intent of it. And I think when you take that approach, there really is hope for improvement outcomes.
Roughly between LCFS and LSSI, we represent about 25% of those 22,000 children that Ashley was referencing. And, coming from very strong places of faith and faith tradition, if we get good at this, like LCFS, about 90% of our budget comes from children in care. But we're not in this for business purposes. We're in this for what's right for children. So I think as Lutheran Day and as both of our organizations, we always lead from our place of faith and what's right for children. So extrapolating that to ICOI, I've been very pleased that the provider community in Illinois, and as I said, within the child welfare space, and as I said, between the Lutheran organizations, we're a quarter of that, have said, we just need to do what's right for families. We need to do what's right for children. And we know that whenever possible, unless there's such a significant safety risk, that if we can keep families strong and serve them as a whole, that's the right thing to do, even though that may have a significant effect on bottom line. But that's not what we're here for. That's not what both organizations have, over a century of commitment to in our state and in our country. So that's one of probably my biggest areas of pride, is that we advocate for what's right for children.